Good morning. So we are continuing the lesson Women and Sports, and the topic we are discussing today, that is female athlete triad. We have discussed little bit about female athlete triad in previous video. That female athlete triad, these are the three disorders commonly seen in women athlete. These are anemia, osteoporosis, and amenorrhea. These disorders are common in any women, but especially the women who are participating in sports activities, intensive sports activities, highly involved in intensive physical activities. So mostly they suffer with these type of disorder. So we will discuss in detail about all these disorders. So first one is, we have to understand what is female athlete triad. It is a health concern for active women and girls who are driven to excel in sports. It involves three distinct and interrelated conditions. These are anemia, amenorrhea, and that is menstrual disorder, and osteoporosis, that is low bone mass. So these three disorders, which are very common among women athletes. Now the question is, who is affected? Because these are the simple problems, and any women can suffer with these conditions, but athletes are highly prone to these activities because of the participation of intensive activities. So who is affected? Anyone may be affected. First is, anyone may be affected, because these are the simple problems which are commonly seen in people, especially in women. So anyone may be affected, but female participating in activities which emphasize leanness at high risk, especially the women, sports women who are participating in high intensive activities or high intensive physical activities. Gymnastic, ballet, diving, figure skating, aerobics, and running. There are intensity is higher in these activities. Then we will see the symptoms. What are the symptoms for female athlete triad? Symptoms of triad may include fatigue, frequent injuries, loss of endurance, irritability, increased healing time of injuries. Injuries take so much time to get healed up, and cessation of menstruation. These are the symptoms which are commonly seen when the sportswomen are facing the condition of female athlete triad. So we will discuss one by one these all female athlete triad, conditions of female athlete triad. So first is anemia, amenorrhea, and osteoporosis. So first, anemia we are discussing. Anemia is decrease in the amount of RBCs or hemoglobin in the blood. Female athletes often face anemia due to iron deficiency, regular menstrual loss, loses increase the iron need of female athlete. As I have discussed in previous video, then you can go through the previous video to see about more detail about the anemia. Iron is we need as per the daily requirement because it cannot be stored in our body. In case of women, they lose the certain amount of blood during menstruation in each month. So that's why they need more iron to recover that loss of the blood. They need to take extra care to fulfill additional iron requirement of the body by taking iron rich food. The symptoms we will discuss, symptoms of the anemia. Various symptoms are there, like we have discussed the paleness of skin, color of tongue and eyes, because blood cells are reduced, red blood cells especially, hemoglobin and RBCs are reduced in the body, and body ache, drowsiness, the person try to sleep all the time, and cold hand and or feet. So these are the symptoms. Then we will see the symptoms of anemia. Respiratory problems are there, shortness of breath, digestion problem is there, in which we can see the change in stool color, muscles, there is pain, muscular pain, which lead the body ache, fainting and fatigue, which is due to the effect over the central nervous system. Heart problems are there, angina and heart attack, spleen, enlargement of the spleen, skin, the yellowing of the skin, yellowness color of the skin. So these are the various symptoms of anemia, and we have discussed in previous video also so many symptoms like irritability, drowsiness, mood swing, lack of focus and concentration, tiredness, and cold feet and hands, fainting. So various symptoms are there. These are the symptoms in which color of the eye and skin change, spots over the nails can be seen. The person feel discomfort, blood pressure comes down. So various symptoms are there. The body temperature decreases. So various symptoms are there while the person is suffering with the anemia. Now we will come to the osteoporosis. Osteoporosis, it is referred to decreased bone material content. As we know that bone is made up of calcium, phosphorus and other minerals. Gradually the deposition of calcium and phosphorus and other minerals takes place in the body, and it is continuous process. So bones are known as the storehouse of calcium, phosphorus and other minerals. That's why the bones are a rigid structure, they are hard structure, and this gives strength to the bone, and this is known as the bone mass. So during osteoporosis, osteo means bone, porosis means porous. So bones become porous. So while the content, when the material, the bone content is decreased, means the calcium, phosphorus and minerals are lacking and they are decreasing in the bone, so they reduce the bone mass, they decreases the bone mass. So that causes the osteoporosis. It is a skeletal disorder because bones are the part of a skeletal system. It puts women athlete at a risk of bone fracture. Anyone who is suffering with the osteoporosis is highly at the risk of bone fracture. So we are talking about the female athlete triad. So it put women athlete at the risk of bone fracture. Low estrogen level and low calcium intake can lead to osteoporosis. Following factors lead to osteoporosis among the women athlete. So low estrogen, why the estrogen hormones? The estrogen is known as the sex hormones of the female. So why it is decreasing? Because estrogen increases the absorption of calcium in body. So that's why when the estrogen level decreases, and in case of like when the estrogen level decreases, like when the menstrual disorders are there, when the women is suffering with women is facing the condition of menopause, when the menstrual cycle ends. So in that cases, some of the cases, the women face the condition when the estrogen level comes down, or there is lack of estrogen hormones in the body. Estrogen hormone is not being formed by the body. So in that case also the calcium absorption will be reduced, and then it can lead to osteoporosis. Another factors are causes are there which cause the osteoporosis: insufficient calcium in diet, eating disorders, wrong eating habits, and amenorrhea, that is menstrual disorder. So osteoporosis, as we know why the word osteo and porosis. So the word is made up of two words, osteo plus porosis. So osteo means one word and porosis is another word. So this is osteoporosis. Osteo means bone and porosis means being porous. So that's why the osteoporosis means when the bones become porous. In picture we can see, one is the normal bone is there, another the bone is porous. So this is the osteoporosis. We can see the different pictures are there. How the bone is being porous. In the first picture is normal upper one, second down the picture you see there, the bone is being porous. In case of the vertebral column, we can see there, due to the deficiency of calcium and bone mass, the bone is bending. The backbone is bending from where? We can see the curve, excess curve here, which can lead to another serious problem. So osteoporosis symptoms we will see. The symptoms of osteoporosis. So various symptoms are there. Like the first one picture we can see, loss of height over time at the time of growth and development. If there is the deficiency of calcium in body, so it can lead the loss of height. Back pain, very common due to the calcium deficiency in case of osteoporosis. Bone fracture is another very common cause. In small incidents, even while the person is falling down, so the bone get fractured. Small hit to at the site of the bone can cause the bone fracture. So osteoporosis makes the bones weaker. The bones of the body becomes weaker. That's why they get fractured. Hunchback, hunch posture, that when the bone, the spinal column, the spinal vertebral column bend outward and neck drop forward. This is the hunch back or hunch posture. So there are various symptoms, and especially the main symptoms of the osteoporosis, that is pain at the site of joints and especially at the back pain, at the vertebral column site or the spinal cord. The back pain is very common. If there is frequent back pain, so then we can see then maybe we are suffering with the calcium deficiency. So now we will discuss about, so what is the treatment for this? Then we can see here. Then in case of the amenorrhea, calcium rich diet we have to take, and sometimes the calcium we are taking but it is not being absorbed in the body. So for that we can have vitamin D3 we can take, that increase the absorption of the calcium in body, because vitamin D is produced in our body, it is synthesized in our body in the presence of sunlight. When the body is unable to produce vitamin D, so then in that case also we can suffer with the calcium deficiency and it will lead the osteoporosis. So we can see then either the bone, the calcium is getting absorbed in body or not. So if we are taking calcium rich, because most of the food items they contain calcium, like if we are taking milk products, if you are taking, especially milk is high rich in calcium, and various vegetables and grains also contain calcium. Animal food also contain calcium. So calcium is there. If it is not being absorbed, so we can go take the amount of vitamin D3 from outside by consultation with the dietitians and the doctors, and it may be affected due to the estrogen, secretion of estrogen in case of female athlete or in case of female. If estrogen is not being produced by the body in sufficient amount, that can also lead the lack of absorption of calcium. So it can affect the absorption of calcium, that will lead the osteoporosis. So we can treat with the osteoporosis by taking excess amount of calcium or calcium rich food along with vitamin D. So this is all about the osteoporosis. Now we will go to the amenorrhea. Amenorrhea, it is absence of menstruation for 3 months or more, that we have discussed in previous video in menstrual dysfunctions. Amenorrhea is the absence of menstruation or menstrual cycle for months, for years, and without being pregnant, because in case of pregnancy there is no menstrual cycle, so the woman is not pregnant. After that she is missing the menstrual cycles for several months and year, so that is the known as amenorrhea. Primary amenorrhea, delayed beginning of menstrual cycle, and even the girl child or the woman has not faced MENA, primary amenorrhea. Secondary amenorrhea is stopping of regular menstrual cycle for 3 months or more. She has normal menstrual cycles for earlier, and then now she has not any menstrual cycle, so that is the condition for 3 months or more, so that is the condition of the secondary amenorrhea. So various factors influencing amenorrhea, that is hormonal changes, intensive exercises, intake of less calories. So amenorrhea, we understand now, this is the absence of menstrual cycle. When the menstrual cycle absent before the 18 year, that is before 18 or 16 year, the girl child does not have MENA, does not reach the MENA, that condition may be the primary amenorrhea. And if the menstrual cycles are absent after 18 year for several months or year without being pregnant, so that is secondary amenorrhea. Now we will come to the preventing the female athlete triad. How we can prevent female athlete triad? Pressure to achieve unrealistically low body weight should be avoided by coaches and parents. Sometimes there is pressure unrealistically achieve the avoid the weight should be controlled. The pressure of controlling the weight. It may be in sports, it may be the parents' pressure. So sometimes the pressure is there to control the weight, so that also leads the when the persons are trying the methods, the illegal methods to control the weight due to the pressure, that also leads the female athlete triad. So we can prevent it. Out of competition, weight in should be discouraged. When we are not participating in any competition, so that time most of the athletes gain weight. So we should always maintain the weight, because when we are gaining the weight, then we have to lose it while we are participating in activities. So that put excess pressure of losing the weight. So rather than gaining the weight in the off season, so we should always try to maintain our weight by performing various activities. Rules governing sports should be examined, and rules encouraging excessive leanness should be revised. Athletes and coaches should be encouraged to look for warning signs of eating disorder. Sometimes athletes have eating disorders. They put themselves, they opt certain wrong eating habits. So this can lead eating disorder that we have discussed, bulimia nervosa and anorexia nervosa. So the signs of the eating disorders should be checked by the coaches, and the athletes should be encouraged to look after these warning signs of the eating disorders. Then we will see another topic, that is psychological aspect of women athlete. Psychological aspect of women athlete, that is, there are various factors which affect the psychology of the women athlete. First is gender role orientation, because due to gender inequality, sometimes the psychology of the women is affected. To represent themselves, being as a female athlete, how to represent themselves. So that is another the factor which affect the psychology of the women. Competitiveness, because now the sports are highly competitive. So this competitiveness nature of the sports, that also affect the psychology, because they have to prepare themselves up to the top level and up to the high level of competition. Confidence also affect the psychology. So always the higher confidence, a good level of confidence is considered good for maintaining healthy psychology. Self-esteem. So we will discuss these in detail. Self-image, depression and aggression. Self-esteem, that is, self-esteem is that we always respect ourselves. We should always feel that put our confidence higher. Self-image means how we look ourselves, how we picturize ourselves. Depression, that is when the person is suffering with the depression, that person is unable to set up the priorities. Aggression is needed in sports, but optimum level of aggression is needed. High level of aggression is always dangerous. So these we have discussed. Then sociological aspect of sports participation. So sociological aspects, there are lot of sociological aspects which affect the participation of women in sports. Family, interest in sports by the children. First is family. Interest of sports by the children usually preceded by the parents' interest. Sometimes parents are putting their interest over the children's rather than the children's own interest. We should never force the child to work against their interest. Let them do whatever they are trying to do, whatever they are interested. So sometimes the family also affect the participation of women in sports. So this is mostly we have seen the girl child especially, is willing to take part in sports activities or any particular sports activities, but parents are not helping, not supporting. They want their child to do something else or to participate some another sports activities. Socializing process, this is at home for both gender is different. Socializing affect a lot of the participation of women in sports, because family is the first society where we learn a lot of social ethics. So it affects a lot. So first part of the family, that is interest, and second is socializing. Second is school. School is important place to provide opportunities for sports participation to any child. So sometimes the schools are lacking this sports opportunities, sports activities for their students. The children who are getting plenty of opportunities to participate in sports activities, always it helps them to select any stream in sports field, and it creates interest among the children to participate in sports activities and make career in this field. Coaches peers and teachers are the main driving force. In a school, the coaches, peers, and teachers. These are helping the child to create interest, to develop interest, and to participate in activities, to learn the sports skills, and to get knowledge about the sports, which will help the child to make a career in sports and games. So it will increase the participation of women in sports activities. Next is culture. Culture has a great impact on the involvement of female in sports. So the traditional values in India encourage the women should stay at home and look after the family. So which should be changed, because these cultural and traditional values, traditional effect is more in women participation, especially in sports activities. So where these traditional and cultural values are modified and people are open-minded, so then that will help the women to participate in sports activities in more number. Then ideology. So we will discuss about the ideology and some more topics in the chapter psychology and sports. So this is all about the today's video.